Hey, Dr. David Schiller here, and I'd like to welcome you to your second visit. We're going to be relating to you what we found in the initial examination and case review, and I would like to go over some principles by which we guide our case, guide our care for you. And as a result, it'll tell you what to expect, what we're going to be doing over the next few visits, and how we're going to make you feel better. So, first of all, we'll be going over how long it may take. We'll be going over how much it's going to cost, and we'll be going over how we're going to go about helping you. So let me just go over these general principles so that you can get an idea of how my thought process is in this whole matter. So first of all, when we examined you, we examined the connections neurologically between the brain and the body. This is the system that runs your body. It runs your inner chemistry, so if you're dealing with a metabolic problem, whether it be diabetes or a thyroid issue or a digestive disturbance or a neuropathy, there's going to be a neurological connection. The nerve system controls everything, and as a result, we want to find out how to get this thing working better, because in the initial exam, we found interferences along these pathways. So as a result of these interferences, whether they're related to the spine or whether they're related to the brain, we're no longer dealing with the fact that you're functioning at 100%. So when you are functioning at 100%, that's how we determine how healthy you are. So as a result, we are determining the status of this nerve function. When stress comes along, we're determining now, okay, what's coming into the system and what's disturbing this thing in the first place. So that could be physical, it could be chemical, or it could be emotional. So physical stress would be old injuries, the postures you keep at work. Are you working at a desk all day long? Have you done lots of yard work, or have you participated in sports where you physically stressed the body? Have you had old car injuries, old injuries like that? Chemical stresses coming in could be the air you're breathing, the water you're drinking, the food you're eating. Do you have sensitivities to foods? Do you have vitamin deficiencies? Do you have hormonal imbalances? Do you have anything that could be chemically related that is stressing this system? And on the emotional side, everybody thinks of stress as emotional. That's why I went over the other two first, because the emotional stress is just one aspect of stress, and obviously we all have stress of all three types, but most people think of emotional only, so I wanted to point out that there's more than just emotional stresses. So as a result of these stresses, now, there can be interferences produced. If they're spinal in nature, we call them subluxation, which means malfunction in the spine and the way the nerve segments, the vertebral segments are moving, how they're positioned. There could be other blockages. There could be blockages in meridian pathways of acupuncture. There could be blockages in some other aspect of the nerve system up into the brain, brain stem, cranial nerves, cerebellum. Some of the tests we did in the original exam were cerebellar tests, how you're balanced, how you hold yourself in space. But either way, these blockages can occur anywhere along these pathways, and as a result now you start to malfunction. So no longer are you digesting food as well as you could. No longer are you able to move as well as you could. No longer are you able to posture yourself as well as you could. No longer are you able to do anything as well as you could as long as there's neurological interferences. So you're no longer functioning at 100%, but in a state of malfunction. As a result of that, your body will now accumulate damage or a process of disease. In other words, your body, instead of healing, is now accumulating damage. You know, every year you have a whole new body, practically. So if there's malfunction going on, the body that's replacing itself is replacing it in a damaged state. So as the disease process accumulates, eventually you pass over that threshold, and that's when you get symptoms. So name any of the symptoms that you're dealing with. It can be coming about from this process. So our objective is to now, for the next few visits, determine how much of that type of care do you need by removing these interferences, by inputting into the spine and a chiropractic adjustment, by giving you brain-based therapies to do in the office or at home, to give you exercises to do, how to hold yourself at your office, how to position yourself ergonomically at your desk. We'll start talking about that. But on the metabolic side, we want to start looking at, are there factors in your diet? Are there factors in supplements that you should be taking? Are there factors in any other type of chemical stresses that we need to address in order to get this system working better on a more permanent basis. So that's the basis of how we're going to be dealing with you. So I look forward to seeing you again, and make it a great day.